And just so you know, yesterday we discussed this. We decided we were all pretty much against fraud. So there was a pretty universal thought about that. So we thought it was bad, and now we're going to learn some more about that. And while it's getting set up, I don't think this will be the last meeting on fraud. And the purpose of this is to bring us up to date on what is happening, how to better strengthen the hand of the department if they need that, how to help them focus their efforts, and in an effort to do the least amount of harm to the people who didn't do anything wrong, and the maximum amount of inconvenience to people who are doing things wrong. So, and so that's the point of the hearing now, and then well, I think we'll revisit this again in November, and then session will come up in February, and so we think about lawmakers as we pass laws, and it makes us feel good, and sometimes the laws we pass are not as productive as we thought, but we felt better. So we want to make sure that in the name of doing good things, we're actually doing the best things. So it's like on the TV host, filling in time while we're waiting for our affiliate to switch over to the football game. And the weather up here is wonderful. We've had a wonderful shopping season.
You need a headphones.
Oh, keep going.
It's like we're warming up.
Okay.
There we go.
Should be shortly.
Houston, we have power. Panasonic. Welcome to the committee, Ms. Ham.
Thank you, Mr. Chair. For those of you that weren't here yesterday, and as a reminder, I am Carolyn Ham. I am the Inspector General for the Department of Human Services, and I really appreciate the opportunity to come and tell you about all the great work that we're doing in the OIG. It also is a nice, handy little chance for me to explain what we do, since I've been here since March, and you would hope by now I can say it. So this is homework for me, if nothing else. So I appreciate you indulging me here. Oh, that's the end.
Thank you very much, and have a good day. Well, we are running ahead of schedule. That's good. Yeah.
All right, let's see here. All right, let's try that again. I see. It was operator error, not the technology. So first of all, I want to say, Senator Abeler, that I completely agree that I would hope that fraud is a bipartisan issue. All of us want to make sure that the dollars that we are spending are going to the people that need it in the proper way, and that we're not wasting it, and we're not paying it to people that aren't providing services. So I agree that this is a bipartisan issue, and I think we can all work together on it. So just wanted a little refresher. The OIG itself has only been in existence since 2011. We now have 4 different divisions, one of which is the licensing division. You may be hearing from Reggie Wagner this afternoon on some of the child care issues, but that's within the OIG. We've got our background studies division, which is doing the background checks for all the various folks who are working with our vulnerable adults and children. Then we've got the Financial Fraud and Abuse Investigations Division, which will be the focus of today's talk. And then we have our OIG Legal Division, because we have a lot of, in any instance where we are taking a benefit away or imposing something on a license, there are, of course, due process requirements, and so we need to be able to defend what it is that we've done. So if we start with the FFAID, and believe me, I'm working on a new name. I think it's way too mouthy, and I'm working on it. If you have any ideas, let me know. So we've got a couple of areas pointed out here, but I do want to talk about a couple of the other ones too, just so you are aware of the various things we're doing. So one of our charges is our SIRS unit, and that is looking at our providers who are billing in the medical assistance space and making sure that they're billing appropriately, et cetera. We also have our child care fraud unit, which is looking at the child care assistance that we provide to people that are trying to get out on their own, and we're, again, looking to make sure that the money that is spent there is spent appropriately. But we also have a couple of other areas. We specifically have a area that looks at fraud within the Minnesota CARE program. That's a much smaller unit, but we do have that as well. We have a key piece is that we have to monitor what the managed care organizations are doing. As you are well aware, many of the folks within medical assistance are being served by our managed care organizations. And it's their responsibility to be looking for fraud, waste, and abuse. But it is our responsibility to oversee that, to make sure that they are doing a good job. And so that is one of our mandates, and we are starting this year, we're going out and we're actually doing an inventory assessment to make sure each managed care organization, what do they have in place, what could they be doing better, and so we hope that we'll be getting a more robust response from them in response to this. We also have our Medicaid restricted recipient program, which is to help those folks who may be struggling with drug abuse, substance abuse, to get them to not be able to doctor shop, so they are required to go into one primary care provider who then makes sure that each of whatever the care that they're seeking is appropriate, and the numbers in those programs have gone up quite a bit. We have over 3,000 people in that program currently. We also have our provider screening unit. And what this unit does is they actually go out and physically visit each new provider that comes into the medical assistance program. And that way we can first make sure they're not a storefront, they actually exist, but then also make sure they understand some of what the responsibilities are. And if our screeners go out and they think, something doesn't seem right here, they don't seem to have the technical expertise, they don't seem to know what's going on, maybe they get just a suspicion that there's something going on, then they can refer that to our SIRS unit, and they can take a look at the billings that then follow to see if there's anything that seems suspicious. The final area that we do more oversight than actual investigation is in the recipient eligibility fraud area. And so the way our state handles that is that we provide grants to each of the counties to fund fraud investigators, and then they are the ones who actually investigate recipient fraud. We provide technical assistance, we provide oversight, but it's actually the counties that do those investigations. I really wanted to hit on this point because I know we talked about fraud, but when we think about from a program integrity spectrum, if you think about it, there's a lot more of inappropriate payments than just fraud. Fraud, we know that, right? That's, you're not providing the service, the service isn't needed, it's intentional. And that's when we try to bring in the criminal aspect of it. But there's an awful lot of other billing that falls short of that. And so we think about error, which is, of course, what it says. I double billed for something. I didn't realize it. It wasn't intentional, but we should be catching that. If they don't, we should be catching it and getting those payments back. There can be waste, which typically the way I look at it is it doesn't add to our clients' overall medical needs. So it's tests that are ordered that really aren't necessary, that don't help the process. Then we've got abuse, which to me is sort of in between. It's to a degree that we can't say this is just inadvertent. We can't say it's just plain old mistake. We may not be able to prove that it's intentional, but it's to a degree that we're going to call it abusive. It doesn't particularly matter except in when you get to a level of proof. Obviously, if you're in the criminal courts, you have clear beyond a reasonable doubt. When you're in the administrative process, it can be either clear and convincing or preponderance of the evidence. So, but the point is, all of these could be inappropriate and probably should be paying us back, but we don't use the same tool depending on where we are on the spectrum.
Ms. Ham, I'm a provider. I have part of your system, and most of the, on the healthcare side, it seems like most of the carriers would notice if we double billed. They just say, oh, we already paid that. What's an example of a provider that, the software, that would not pick up a double billing for the identical thing?
Thank you, Mr. Chair. So an example of it is where it gets a little bit more complicated, and I'm sorry if I get too technical here.
Well, just brief. I don't need the detail.
But basically, if you think about many medical services, they have two components to them. They have a professional component and a technical component. And typically, so the idea is the professional component is the provider actually doing the service, and the technical component is the equipment, the office, et cetera. And so you can bill separately for those. You can bill all together for those. So what you could have is you could have a hospital that bills for both. So they bill technical and professional. And you have the physician who bills the professional. They don't know that they have double billed because they don't submit claims together. That's a situation where potentially, well, certainly the provider wouldn't catch it because they have no way to know that somebody else has submitted a claim. It would be up to the claim software to catch that.
Yeah, all right. But it doesn't happen in childcare or like that. I mean, the counties keep track of that pretty well. I just think it'd be careless if they're. It seems like that's a problem we shouldn't have to solve. That should be
right, Mr. Chair. I agree,
management.
and it really has to do with the complexity of the healthcare system.
Yeah. More on the healthcare side, then.
With healthcare, it's just so complex in terms of the billing that those things can happen. I agree that I would hope that in the child care world, where it is far more simple, none of this splitting professional, technical, whatnot, that we wouldn't have those kinds of
Thanks.
issues.
Didn't mean to sidetrack you.
Okay, so talking about specifically our SIRS unit, which is Surveillance and Integrity Review Section, we are required by the federal government to have such a unit, and we are also required to, whenever we do find a credible allegation of fraud, we're required to refer that to the Attorney General's office and their Medicaid Fraud Control Unit. And as I said, again, this is whether it's in the fee-for-service or in the managed care space, there's still that obligation. I talked about this a little bit yesterday, but to let you know sort of the size, we've got 16 investigators in our SIRS unit right now, and thanks to the legislature, we have 10 additional staff that will be coming on. We are hiring 7 investigators, but we are also hiring data analysts. And this will be a theme that I will come back to a couple of different times. Maybe it's a symptom of coming from Optum, but I think it's more just a realization of where we need to be looking. And that is that we really have to get much more proactive in looking at our claims and looking at our data and determining where there are spikes, where there are outliers. And so I have intentionally am increasing the number of data analysts so that we can do some of the really fundamental work that needs to be done so that we can be having a better sense of what's happening in the spending. I think that this is, oh, I'm sorry, go ahead.
So is this current 16 investigators, have you done the hiring of the additional 7, and so you went from 9 to 16, or are you at 16 and haven't done these hires and you're going to whatever, 23?
We're at
Going to 23.
Thank you, Mr. Chair, Mr. Senator Laurie. Those will be additional. And so we have posted them. We've already gotten applications, so we're hopeful that we'll be able to get those folks in very quickly. So I wanted to talk about the kinds of actions that we can take because I think it's important to realize that we don't just hammer everyone. Okay, so again, recognizing that there's a broad spectrum of the intent, the magnitude, whatnot, we don't hit everybody with the same punishment, if you will. We can simply issue a warning letter to let them know, hey, we noticed this, you should be on guard for this. We can recover an overpayment. We can enter into settlement agreements, which oftentimes will have some corrective action aspect to it. You agree that in the future you will put these following safeguards so that this won't happen again. We can refer it to other state agencies. We can refer it to law enforcement. As I say, we're required to refer it to law enforcement in the Medicaid space if required to refer it to the Attorney General's office. We can withhold payment, which is one of our more drastic remedies. We can terminate or suspend a provider from the medical assistance program. And we can exclude a provider. One of the other things that I forgot to put on here, and goes to your point, Senator Ralph, yesterday in terms of recoveries, is for certain high-risk providers, we actually require that they post a bond. And so if in the event that we find that this provider has an overpayment and they go out of business, they refuse to pay us back, whatnot, we do have the ability to go after those surety bonds, and we have. And so that's a tool that we may want to look at expanding to see if we can use that even more.
Senator Hoffman.
Mr. Chair, I want to go back. You had mentioned about 7.5 minutes ago that the software should catch it, meaning that there's a data provision. And I'm not an expert in data, although I did stay at a Hotel 6 once. But seriously, yesterday we heard the conversation about the collaboration between the Department of Human Services and Minute. And Minute had mentioned they have 600 to 700 IT people that are working there. And so as you're looking at this conversation of data driving, data diving, data, whatever you're doing to find out, and if software is supposed to be able to catch that first phase of it, what's your relationship with the Minute, and how is this integrated in the agency that should be helping other agencies perform the sophisticated IT stuff? Because I just in envisioning adding more data people, and yet we still might have the same problem, and we just keep adding to it. And it's more of a question and a discovery process than anything else.
Ms. Ham.
Thank you, Mr. Chair. Senator Hoffman. That is an excellent, excellent question. And so I think what we have to look at is, in my mind, it's baby steps. So right now, any edits that would be put into the system would be within the provider enrollment area, within the healthcare administration. They have responsibility for any of the prepayment edits that get put into place. But what we can provide is, at least after the fact, running the data ourselves and finding those instances, which sometimes can't be caught up front. The example I gave, it's dependent on the two claims being able to be connected. But after the fact, we can come in and assess and say, okay, here's an issue where there's an overpayment, and we can do it. So we don't have to, if it's after the fact, we can do some of that. We're also considering whether we need to get some outside help with that. And there are many, many, many vendors out there that would love to help us, and we'll be assessing that as well.
Senator Hoffman.
So as a follow-up, I know the Minute agency was created by legislation to help collaborate our efforts. And when you say there's many, many vendors out there, that's still not answering my question on your collaborative efforts with Minute and on that side. So it sounds to me like you're doing it a standalone and you're not getting the support from Minute. Did I not hear you right?
Ms. Ham. Is that also an excellent question? I think people, the witnesses, should feel free to rate the question. It's like an excellent one. And if it's really bad, just give us an eye roll. Okay. Anyway, Ms. Ham.
Thank you, Mr. Chair. Senator
Ms.
Hoffman.
Ham.
I apologize. I apologize for not answering your question. It was not intentional. No, we are working within Minute, but as you correctly pointed out, there are many priorities within the agency. And so we all have to work within those priorities, and there are limitations. So it's not that we're not working with Minute. We absolutely are. But there are a lot of priorities, and so it's a matter of figuring out, what's the most important one. And so, no, we are getting support. It's just the agency and Minute can only do so much. And obviously integrating services with the county, some of that stuff is absolutely critical. We're working on systems that are 30 years old. So those are going to get prioritized.
Senator Hayden.
Good. Well, thank you, Mr. Chair. So I know where we're doing kind of an overview, but there's some kind of specific questions about your process. So I guess the question would be, what's the primary way you get information to make you start an investigation, or at least kind of start to look to figure out if there's fraud? I guess that's question number one.
Ms. Ham.
Thank you, Mr. Chair, Senator Hayden. So thanks to Senator Abeler's question yesterday, I actually have some numbers for you if you want them. But basically, we do track what the source of our intake is. And so what I can tell you based on last year is that the majority of our tips, complaints, whatever you want to call it, actually come from other providers. So I think that's quite interesting.
That is interesting. Well, thank you, Mr. Chair
Hayden.
and Ms. And so, so you get other providers. I mean, that isn't too surprising. In like welfare fraud, it's usually other recipients that know, and that's kind of their primary way. The second question is, if you start to, how do you figure out trends, and do trends help to help you decide where you're going to proactively look for fraud? Or maybe the question is, do you proactively look for fraud, and do trend lines help you to do that in a certain geographic area, ethnic group, et cetera?
Ms. Ham.
Thank you, Mr. Chair. Senator Hayden. I would like to say we were doing that already, but we really aren't. At this point, we've been primarily reactive, taking whatever tips we get and looking into them. It is absolutely my hope and intention that we will get to the place where we're able actually to look at the data and look for those outliers and whatnot. And that's a big part of, with this expansion that we're getting, we'll be able to do more of that.
Senator Hayden.
So, Mr. Chairman, so it would be safe to say that you don't do any targeting or profiling of providers by any particular nature when you go out and do your fraud investigations?
Excuse me, Mr. Chair, Senator Hayden, that's correct.
Thank you. Thank you, Mr. Chairman.
Senator, that was a very good question. So no, actually, it was not as good as Senator Hoffman's question, but it was a darn good question. Ms. Ham, continue on, thanks.
Okay, thank you, Mr. Chair. So this just gives you the overview for 2016. Again, within our SIRS area, we opened almost 500 cases. We made 145 fraud referrals, so that would be to law enforcement. We had 116 provider terminations or suspensions. We put in place 70 payment withholds. We closed 374. Cases, and we identified $27 million in overpayments. Again, to your point, Senator Ralph, that is identified, not recovered, and I apologize, but I don't have that number for you yet. We'll have to work on that. It's just more difficult to come up with. Oh, and so again, and to Senator Abeler, you had the question yesterday, and I do have the answers for you with regard to, you wanted to know the total number of tips and what percentage of them were specifically for PCA. Last year we had 1,200 different kinds of intake, tips, whatnot, and 664 of them had to do with PCA. So more than 50% of the tips that we got were PCA.
Thank you.
This just goes through some of the common schemes, fraud trends that we see within the Medicaid space. Upcoding, if you're familiar with that, that's basically saying you did one service that's more difficult than the service you actually rendered, so you get more money for it. Identity theft, whether it's stealing the identity of the provider or the recipient. Robo-signing would mean that you get somebody, either they don't know it or they knowingly go with it and they sign, hundreds of records saying this happened and it didn't really happen. PCA specifically, if we don't know when the start time of the service was begun, then we can't really assess whether they really were there for the amount of time they said. Having unqualified staff provide services. Copying and pasting documentation. This is a huge issue in the electronic medical records space. It is so easy now to simply take everything from a previous visit and pop it right into the next visit. And so what that can create is it looks like you had a much more thorough office visit than you really did. Maybe it was a 10-minute office visit, but it looks like you looked at every system, every system of the patient, and so you can inflate it that way. It's a big issue. You can be falsifying the staff credentials. Kickbacks, whether it's on the recipient side or whether it's between providers for referrals, that's never goes away, unfortunately. I wish it does, but it doesn't. Padding time is an easy one to understand. Lack of supervision, that's a key one. Oftentimes people can be providing services, but they're required to have some kind of supervision. If that's not happening, then we really don't know the quality of the services that are being rendered. A couple that I don't know why I forgot to put them on, but obviously services not rendered has been probably number one. You say it happened and it really didn't. And then also medically unnecessary services is also a big trend. So that completes my presentation on the Medicaid fraud specifically. So are there any other questions on that, or I'll move to childcare?
Move on.
Thank you, Mr. Chair. So again, just a little history. The Child Care Assistance Program, Fraud Investigations, was created. We established it in 2012, basically because we realized there was a gap, that we really didn't have any particular agency that was charged with looking at fraud in the Child Care Assistance Program. So that's why it was created. 2014, we were fully staffed. Right now, we have 4 investigators, and I should have added this. We also contract with the BCA. We have 2 BCA agents that also work with us. They provide us the ability to do search warrants and that sort of thing. There are approximately 1,000 child care providers, so you can see that's a pretty small staff. However, we will be adding additional staff to that. And again, as I pointed out, we're going to be looking at data analysts, the investigators, and then because we anticipate there will be more hearings over child care overpayments, et cetera, we're going to need additional legal staff for that.
And Ms. Ham, I just want to thank you for coining a whole new spate of acronyms. Thank you. That's really
I'm sorry?
helpful. Oh, Doug, thanks for coining a whole new spate of acronyms. I was trying to figure out what CCPI stands for.
I know, I've never used that one.
I got that one figured
Mr. Chair,
out.
I've never used that one myself, and I don't think I will start.
FFAID. So it's in a world that doesn't have quite enough acronyms, you have contributed, so thank you for that, by the way.
Yes, I feel very proud. Again, so looking again at the kinds of actions that our unit can take, it's very depending on the degree of severity, what we have in terms of evidence. So again, we can issue a warning letter, we can recover overpayments. Now, the interesting thing here is that unlike in Medicaid fraud, where if we are seeking an overpayment from a medical provider, the burden of proof for us is simply a preponderance of the evidence. In the child care space, we actually are held to a higher standard. So for our providers that we believe there's an overpayment and they're going to challenge that, we actually have to show that it's inappropriate by clear and convincing proof rather than the preponderance of the evidence, which is a difference. We can also enter into settlements, payment plans, again, corrective action plans. We can refer to law enforcement, and we do have the ability to suspend the provider's ability to get child care assistance payments.
Senator Lurie.
Is that difference in the burden of proof in the 2 different programs? Is that statutorily driven by the Minnesota legislature, or is it something in the federal law that requires the difference? That's interesting.
Ms. Ham.
Thank you, Mr. Chair. Senator Lurie. It is in state statute.
Oh. That was a very good question.
So I thought it would be helpful to just give an overall, since we've only been around since really 2014, just give you the overall numbers. So we've had 49 civil investigations. We've identified $382,000 in overpayments. 11 centers have been closed for fraud, with payments stopped and referred to law enforcement. Of those 11 centers, they had been billing $37 million. 5 of the 11 have resulted in felony convictions, and the remainder of those cases are still in process. A search warrant may have been issued, an indictment may have been issued, but it's not completed. We've gotten $137,000 in restitution from criminal cases, and we have also, when we were talking about the civil process, we have assessed 8 centers. We have assessed overpayments due to the attendance records not matching with what they billed. So again, that's where we have that degree of, we don't shut everybody down for fraud. We look at if there's a small discrepancy, then we assess an overpayment, but we don't shut you down. If it's pervasive, it's over long periods of time, then we'll take more serious action. So just, again, we don't have only a hammer.
And Ms. Ham, it seems as though it's hard to get the money back. And so the biggest tool you have is saying you're out of business, and you try to get the money, but there's none to get, probably, right?
Thank you, Mr. Chair. I would say that is correct, that it is oftentimes difficult to get the money back. And again, it's not that we're going to put them out of business as a child care center, but we will limit their ability to get child care assistance. And with many of these particular centers that we're talking about, they're 100% or very close to 100% funded through child care assistance payments, so it essentially shuts them down.
Right, but so you find a place that's fraudulent, and they've been fraudulent for a while. You have clear and convincing evidence, a high bar, and they owe you $500,000, and you're just never going to get the $500,000 because it's spent on staff or luxury condominiums or whatever. Right?
Senator Abeler, it is often, this is something that we talk about from the very beginning whenever we're talking about payment integrity. It is so much better to stop the money from going out in the first place than having to try to collect it, because you're always going to have a problem with that. We would have some tools to try to collect, but they would not be enough to be made whole. As you say, many times the money is gone.
Thanks. Senator Ralph.
You indicated that in the Medicaid cases that you would sometimes require a bond. Has that been done in where we have high risk, where you've identified someone who, okay, maybe we're not going to terminate you, but, there's been something doesn't pass the nose test, and have you employed that program there?
Ms. Ham.
Thank you, Mr. Chairman. Senator Ralph, I'm going to defer to Mr. Koppel. But I believe we don't have statutory authority to do that. Is that? He wasn't paying attention. Oh. To require a surety bond. Yeah. So we don't currently have statutory authority to require a statutory bond for recipients of child care assistance.
Thanks for almost coming up, Mr. Koppel. And, all right. Well, this is interesting. So keep going, Ms. Ham. Thanks.
So basically, in terms of what do we see in the child care space when we're specifically talking about fraud, these are usually fairly large centers. They're typically billing the child care assistance program more than $1 million a year. Collusion between the parents and the centers is very common. The parents are essentially paid a kickback for each child that they bring to the child care center, or they don't even bring them to the child care center, but they let them bill for them. So either one of those happens frequently, and in some cases, because the parents who would be eligible for the child care assistance have to show that they have a job, the providers will actually help them to falsify the fact that they have a job. They might give them phony pay stubs or something that would allow them to appear as though they're employed.
And Ms. Ham, just to clarify, I think I know what you're trying to get at, but so large-scale fraudulent billing is common among independent centers. Maybe do you mean that if there's going to be large-scale fraud, it's going to be one of those places, but most of them are fine?
I'm sorry.
But it's in terms of incidents, it's not like a licensed home where you're going to see this going on. It's going to be in a center, and the handful of ones who are fraudulent are of that category. Is that what you meant?
Thank you, Mr. Chair, for digging me out of that one. That is correct. I did not mean to imply that most centers
I just wanted to clarify.
Are fraudulent at all. What we're talking about here is the centers that primarily are top billers in the child care assistance program. And no, certainly it is not widespread. It's just the particular when we look at the child care centers that we've looked at, this has been a characteristic that it's over $1 million.
And what percent of the over $1 million ones? Is it just like a couple of percent? Is it
So it's
is it as many as 5%, or what do you have?
Well, so I'm not sure, Mr. Chair, excuse me, I'm not sure if this is exactly answering your question, but there's a very interesting split between the number of centers that get more than $1 million from the child care assistant and then the ones who get less. And it's basically there's 100 centers, give or take, that get $1 million or more a year, and then 900 other centers that get less than $98,000. So there's a very stark difference between centers that rely 100% on the child care assistance program, and then the vast majority of which they have some children who might be eligible, but that is not their main source of income. Did that answer your question?
Yeah,
sir?
okay, so there's 100 over $1 million. So is it like 3 or 4 you would expect in that group, or is it 10? I mean, is that even, don't answer the question you can't answer, but it's.
Mr. Chair, I don't know the answer to that.
That's fine. Okay, keep going. But it's really interesting, by the way, and it's something we need to know as policymakers and as we try to craft. But if there's going to be fraud, you would not suspect the 900 under $1 million. You would, if you're going looking for fraud, you would just look in that group first of all. And I got it. Okay, thanks.
That's correct, Mr. Chair. Thank you. So, just in conclusion, what I am looking forward to in the future is we're going to make great use of the additional positions that you have given us. One of the ideas on my to-do list is to create what is called a provider self-audit. And what that would do is basically the kinds of claims that we were talking about earlier, where it's essentially just a double bill, but the entities didn't know about it, is we will do the data mining to determine those. We will send that list to the providers, and we will ask them to do the audit, because it's a very high percentage likelihood that was just incorrect billing. And so we'll put the onus on them to make sure to go back and look to see if there's an error, and if there is, they can pay it back. And so again, the notion here is we're going to they have an obligation, providers have an obligation to be making sure that their claims are correctly paid, and these will be ones that are of such high likelihood of an error that we're going to ask them to take a look and determine whether or not there's an overpayment. This is a common, many states have this, and I think it will assist us in getting some of those errors out of the system.
Senator Kiffmeyer.
Thank you, Mr. Chair. So thank you, Ms. Ham. I appreciate especially some of the statistics. It's nice to hear some of those things as well, even if we need to add on occasion. My question here, it's great that we do some of the catching, but also, do you have suggestions on preventing? So the whole process, I mean, you're kind of at the end here into the catching, using tips, analytics, doing all of that. But I think obviously we'd all feel what could be done. There's a surety bond thing that might give them a heads up. Hey, don't do this. What else do you think could be done in prevention?
Ms. Ham.
Mr. Chair, Senator Kiffmeyer, you've gone right to my last point. As I said, ideally, you stop these payments before they ever go out. That is where private payers are going, where many states are going. But we've got to crawl before we can walk. And so it's certainly something that I want us to look at, and it is something that potentially we wouldn't have to do it. It could be an outside vendor that would do it. But again, I want to get some things in place and see. But to me, you definitely want to. And so, for example, one example would be there are systems out there where essentially a claim comes in and they risk score it. And they say, based on various data points, algorithms, whatnot, this is a high-risk claim or it's a low-risk claim. And then because of that, they would stop the high-risk claim, and they'd ask for records. And they'd see, is this legitimate? So that's sort of where the industry is. And hopefully we can get there someday.
Senator Kiffmeyer.
Thank you, Mr. Chair. One other question I have for you on those that you have worked with, and of those 5 of 11 or so on that you found significantly, Was it something that they started out okay, and maybe because the system was so lax that they started going into, well, this is so easy, we can just commit a little fraud, and then it got more and more? Or is this something that in its inception it was set up to commit fraud?
Ms. Ham.
Mr. Chair, Senator Kiffmeyer, I was going to rate your question, but I won't do that. But I am thinking about it because the problem for us is that typically we look at a time period and assess whether or not the billings match the actual attendance. So it's hard for me to say whether or not they started out that way because we typically just look at a period of time. So that's why I just hesitate to, I don't think we know which scenario it was.
Well,
Senator Kiffmeyer.
thank you, Mr. Chair. And the reason why I mentioned that, prevention is very different. One of them is when you license, that due diligence is done to make sure that the licensing is appropriate, that they have all of those things. That's where a variety of things. The other one is they pass all of that, and then later on the system is so loose, it is too tempting, too easy to slip into fraud. And I think the solutions are very different depending upon the answer to that. And it might be something, I know, your baby steps and you get started, but maybe at some time because the solutions are different.
Ms. Ham.
Mr. Chair, Senator Kiffmeyer, I agree with your point. I would just point out, though, that licensing is going to be looking at one set of issues, mainly having to do with safety and adequacy of the, do they have toys, is it safe, et cetera. And so that's not necessarily going to stop the issue of you might have a perfectly lovely center that is sparkling clean with all the cleanest toys, but if no children are actually in there, you're committing fraud. So I appreciate what you're saying, and I will certainly give that a lot of thought in terms of what kinds of things could we be doing. Because I agree, we don't want this money to be going out. And of course, the other issue, which is really the fundamental issue here, is these children are not getting the care that we all want them to get. If they're not going to the center, or if the center really isn't operating properly, then they're not getting the benefit of that service, and the parents may not be getting the benefit of the work experience that we're hoping they will get. And that really is the bottom line why we are so concerned about this. We want those children to get the education that they need so that they can enter school and be ready to go. And so I think we all share that common goal, and we're going to do what we can to make sure that if they're in there, they're getting good care, both from a licensing and a fraud perspective.
Senator Kiffmeyer, I believe you have a committee that may dabble in this topic once in a while. So anyway, so I think this topic is not done for the time, but I think this is, any other questions? Senator Lurie.
Maybe I'll piggyback a little bit on what Senator Kiffmeyer was talking about there. And so, a development of a prepayment review to prevent an inappropriate payment from going out is a prevention of a sort, but it's sort of a secondary. I mean, I think that one of the things Senator Kiffmeyer was also trying to get at was, not having the situation where the payment even was filed. I mean, trying to make sure that you have, a licensing scheme and these other primary prevention methods even ahead of that. And you need to think of each of these points carefully. And so, advice on that would be welcomed as we move forward as well.
Well, thank you. I think this has been a productive discussion. Thanks, Ms. Ham.
Thank you.
And we have two citizens who have offered to come and offer their thoughts, Mr. Jamali, and somebody want to flag Omar. He's in the hallway, I think. I thought I would go out. Anyway, maybe no one's going to do that. So welcome to the committee.
Yeah, thank you, Senator Abeler and committee members. This is a very important topic, and my name is Mustafa Jamali. I work on government relations for the Minnesota Minority Child Care Association, which is a new association of about 70-plus East African-owned child care centers throughout the metro area and in greater Minnesota. We strive to provide high-quality child care services to our clients that is culturally appropriate while keeping child care access affordable. We are working with many of our members to help them get parent-aware rated. Also, we provide our members with updates on child care policy to make sure our members are in compliance with state and federal laws. In the last couple of months, actually, we have been working with DHS on a number of issues, including fraud, and our association has a zero tolerance for fraud. And so we've been working with DHS to educate members of our community on the consequences of fraud and how it impacts their children's education. In our opinion, everyone wants to eliminate fraud, that's clear, and many agencies are actually working on coming together to talk about this and are working on it. However, there seems to be a need for more communication and collaboration between DHS and all counties. And also the child care community needs to be part of these discussions as well, and we need to be partners in this effort to combat fraud. So it's our opinion really that in the past couple of sessions there have been some regulations that have been difficult, particularly for immigrant-owned child care centers. And we believe that if the goal is to prevent child care fraud, some of these laws have proven to actually not do that, but kind of become a burden to some of our members. And we believe that the state can't legislate its way out of this issue, and that this needs to be a community-based approach to work on it. So really thank you for having this hearing, and we look forward to working with DHS and this committee on combating this issue.
Well, thank you. Now, there's been a lot of discussion, and I appreciate you working in a proactive way. I think this is one of those upstream things where you get the community as a standard and as a way of doing business, that you take a position. And I know the discussions are ongoing, and Mr. Koppel has invested a lot of time, and I know some of those discussions firsthand. Any members, any questions? Or Senator Ralph?
Thank you, Mr. Chair. Mr. Jamal. You mentioned that you felt that some of the legislation has inordinately or disproportionately affected minority child care centers. Can you elaborate on that just a bit?
Mr.
Sure.
Jamali.
Yep. Mr. Chair, Senator Rolfe. So basically, there have been some legislation. In particular, there's an effort to limit the ability for child care centers to hire the parents of some of the children that are being served by the child care centers. And in the Somali community, in particular, some of the people who are working at these child care centers are really some of the most unemployable folks in our communities, folks who are new to the United States, who aren't connected to community, and who haven't worked in kind of a formal setting before. Obviously, we're not referring to these people as like coming from a place of deficit. Wherever they came from, they were employed and were able to live. But they do, work at these centers. And so there's been an effort in order to crack down on fraud to also just limit the ability for some child care centers to hire these parents who are, actually doing really interesting work, from being cooks to drivers to being assistants. And so we're, working with DHS to create hopefully a pipeline for some of these parents to become child care professionals, to get training and, to advance their careers. So.
Senator Ralph. All right. And the discussions will continue. And we talked yesterday about the department having a good year. I think they're doing what they can. And I think the idea about certain sizes and with the fraud issues, and they're more likely to be somewhere, is the challenge. And I think you leading your community and the good workers that are out there doing the right thing are going to turn this in the right direction. And I'm committed to helping with that. So.
Absolutely. And
Senator Kiffmeyer.
Thank you, Mr. Chair, and thank you, Mr. Jamali, for being here. Appreciate your comments very much. And so I think the one thing, though, that I think in hearing your comments and communication and a variety of those things are really important. But on the general subject we're dealing here with is fraud. And that means billing for care not given is fraud. Billing for a kind of care not given. And so I think for your community, most would understand the difference between those two. And I think for you and I think your organization is one of the best. I think the idea to help you yourselves helping each other by informing each other and getting together. And then also I know that DHS and some of those others would be glad to come out and have regular monthly educational systems for you to do that. But in any business, it's always the duty of the business to be informed and educated. If you're going to start it, you're going to have all of that. But I know that there's a big difference, though, and I think what you're talking about is less so much the fraud than in just knowing how to do it right. And I think in that, your organizational grouping, I think, will be very helpful to you, and it gives a place then for DHS to communicate, to collaborate, and to work with you. So commend you in regards to that.
Yes, Mr. Chair.
Mr. Jamali.
Kiefmeyer. Yeah, we really appreciate the work of DHS, and Mr. Koppel has come out a number of times to our member meetings and has provided updates. So we're thankful for that, and we look forward to collaborating with them further. So thank you.
And one of the topics we worked on was how many children of staff could be in a certain site, and we're casting about, the number currently is 25. We were looking for a different number last time, and so again, the question, I don't know if you followed the 2 days of talking about fraud here, but there's some people who are doing the wrong thing, and we want to make sure that the people doing the right thing aren't limited by our effort to go after the other people. And that's the challenge with any formula or number you come up with. And I have a feeling we'll be discussing this number again in the spring. So anyway, well, thank you, Mr. Jamali. And I don't see Mr. Jamal here. And so we're going to move on to our next topic.
Thank you.
Which is federal compliance. And I think that's probably the reason for the large attendance today. People want to hear about federal compliance. And I think the parking problems will be resolved after we're through with this topic. So anyway, Ms. Wagner, Mr. Koppel, and then we have some citizens that I want to testify about this. And our intention is to spend something in the range of an hour on this topic altogether, and if it is shorter, that'd be fine. But we want to make sure we give it proper attention and listen to our witnesses as well, including you all. So, welcome to the committee. And whoever
Thank
wants
you,
to
Mr.
start.
Chair.
Yeah.
I believe I start.
Yes, Mr.
I turn to Reggie to always.
Do you want me to advance the slides?
That might be the safest way to proceed. Thank you. I'll do the same for you when you present.
That's teamwork.
We're very
That's
transparent.
Teamwork we've grown to love and appreciate
We're
about
very
the department.
transparent, and we work really well together. Thank you. My name's Jim Koppel. I'm the Assistant Commissioner for Children and Family Services. If I could make one comment on your previous topic, is that there is a lot of work to do in the Somali community with child care centers. I'm very encouraged with the model that they've stepped forward with, the association, the efforts. We meet regularly. It's our hope to continue setting out, a combination of training, business models, shared staff processes, different ideas where we can get the healthiest, highest quality child care centers in the Somali community in the state. And I think we can do that. I think it's important at the same time to recognize that where there are fraudulent centers, it can pull away from those very good centers because they can do things that are fraudulent. We have a double challenge there. So fraud not only impacts money and integrity and programs, but it also impacts good centers who may be losing people to bad centers. So I just throw all that out there that we're aware of it. We're having really good constructive discussions and look forward to many more, and we're going to take every effort possible to make it all work right. So just wanted to, that's the prevention side, I think, Senator Kiefmeyer, you mentioned, and that may also include a specific staff person who is the liaison to do more training and to go regularly into the community to educate parents about the importance of high-quality child care as well. So the expectation is that the product meets the expectation of the parent. So I'm passionate about that, so I wanted to bring it up as part of federal compliance, but it
Well,
has
Mr.
nothing to
Koppel,
do
this is,
with
yeah,
federal
I mean,
compliance.
it's not as interesting as federal compliance, but I wanted to also commend you. I know, I don't know how many hours you put in, but I know you put in lots of hours, lots of visits, lots of community meetings. And if there's an example about how to try to do it right, you've been the model of that, so.
Well, thank
Under
you, Mr. Chair.
compliance, Mr. Koppel.
Okay, and that's why I did it, so that you could speak to it today. So, federal compliance, as you know, the child care block grant was signed into law in 2014. Am I starting at the right one that you have?
I'll move it.
I don't know where I am. Yeah, so it was signed into law in 2014 in a bipartisan manner by Congress. And this was the first time since 1996 that the reauthorization occurred. So there were a lot of updates. It's the Child Care Development Block Grant is our primary source of funding, and it has three broad goals, or primary goals: to promote access to subsidy for families with low incomes, and increasing the number of those children in high-quality child care settings, improve quality of child care services and programs by implementing oversight standards, which are health and safety, and improving the child care and development of children, and the informing parents of child care choices and providing education information to help parents make informed choices. So what are the changes that we're talking about? We have 12-month excuse me. Yeah, my sheets are back to back. She's helping me. We have 12-month continuous coverage eligibility. We have co-payment fees that are more stable over that 12 months. We have extended eligibility when work or school ends, and we have reduced reporting requirements. Those are the broad changes. 12-month period of eligibility and authorization basically means right now we do it for 6 months, and this would extend it to a year. What we're looking at too, and to think about as we talk about these things, is and was mentioned earlier, the goal of child care is to provide children with a healthy child development, prepare them for kindergarten, stimulate their brains. You know, if we know from all the research, it's when the brain is developing, the vast majority. And so stability of a provider, stability of child care is very, very important. To go to 12 months promises a family, once you're being determined eligible, you're going to have the predictability of child care for 12 months, which will support their work, and there's going to be stability for the child to have 12 months. So it's a great improvement. Next, copays will not increase. Oh yeah, on the back. Copays will not increase during that 12-month period. So once you are found eligible and you have a copayment determined, if it's $80 a month or $130 a month, that will remain constant for 12 months, even if your income increases during that 12 months, as long as it doesn't increase above the federal guidelines, which are way above our exit level. So very unlikely that anybody's income, unless they won the lottery, would be going up to that. The copayment can come down, however, if your hours change and you're making less money. Your copay, you can go in and your copayment can be adjusted downward, but it will not be adjusted upward. So again, that incentive or disincentive that we talk about sometimes with taking a raise or a different job that pays a little more is not going to impact child care. Minimum activity requirements are more flexible and maintain steady authorization as parents' activities fluctuate. So what this is basically saying is if your hours are reduced during this time, you're going to continue to have the same hour allocation. You know, a lot of times there's seasonal work or there's some kind of change in your hours where there's a constant for the child. They have 30 hours in childcare, they're going to have 30 hours in childcare that week. You may be in between jobs, rather than stopping or only allowing a specific period of time for job search. You go right into job search, your hours continue for that child. What we're trying to do is to say for 12 months, that child is going to have the child care they need, and the parents are going to have the support they need to work, to transition to another job, to search perhaps in the middle of that for a different job. But the idea is that we want to have as much flexibility as possible in the system so that a child remains in child care during that 12-month time. I mentioned some of the criteria that temporary changes won't disrupt medical leave, seasonal work, or temporary changes that I just went through. And Senator Ralph, I'm sorry, you looked like you were going to ask me a question, so I'm...
Senator Ralph, sorry, I was not watching.
Thank you, Mr. Chair. Thank you, Mr. Koppel. Just a quick question. When these temporary changes occur, does the agency get involved in trying to help those individuals through referring to DEED or some other agency that would help them in their job search if the change is significant and they're actually trying to look for more work? Is there some provision in this that would help them with that?
Mr. Koppel.
Mr. Chair, Senator Ralph, I think that if we go back to the Dakota County testimony earlier today, that's the ideal situation, where a very good example of where you have an integrated services process that, the caseworker working with that particular family knows that they have, say, lost employment or cut back in hours, or they want to change jobs. There's a vehicle to an employment counselor or employment services, additional training. It's not specific in the child care assistance program. Again, that's part of the siloed nature of programs, but it can be accommodated other places. But I think that just re-emphasizes your earlier comments.
Thanks. Senator Hoffman, did you have a run-of-the-mill question?
I do. Thank you. So, Assistant Commissioner Koppel, I had stepped out just briefly, but I do want to come back on the temporary changes piece. We know, I think the numbers are still there, 45% of the participants in the MFIP side of it on the child care side, especially the Child Care Developmental Block Grant, and this came up back in the early 2000s when the 2-for-1 was left on the table, right? I think you were at a different agency back then. There was some cuts on the state, but that also affected the federal dollars. But what we had seen in those numbers are still, I think, consistent today. 40 to 45% of the participants either have a disability or have a child with a disability. Now, going back to the whole discussion of mental health and child care and mental health in the system itself, I want to focus on the temporary changes. When somebody is having a moment where they're going through some medical issues or some things that are occurring that you can't control, is there flexibility within the system to assure that this case manager is able to say, we're going to try to get you the help that you need? I mean, is there something there that exists so that we're not just cutting somebody off because they might be at a manic side of their life or at a depressive side of their life, or they might have gone into some kind of relapse or something? Can you expand on that?
That's actually the most complicated question of the day. So, Mr. Koppel, if you could sort your way through that.
Thank you. Thank you, Senator Kiffmeyer, for saying that. But there exists, there's such an area, I love it. So it's like,
Mr. Koppel, thank you.
Yeah. Mr. Chair and Senator Hoffman, without weighing in on that debate of your question, I didn't fully understand whether you met the parents of the child, whether you met the child themselves, so if there was a break in employment, say because there was a mental health need of the parent, and therefore changed their work hours, et cetera, and why they sought treatment. It could have been chemical dependency, could have been mental health. And that would be, I'd refer to that medical leave piece where they touch base with the county, and that leave, that period, would be covered. So the child continues, this is just talking about the child, so the child would continue in care, and that care would continue to be covered the same way it was for those breaks. But what doesn't happen in child care and within the CCAP program is, do does the child care provider work with the parent to seek treatment or care, referral? I don't know. I don't think that's what you meant, but I was more talking about assuring the family that the child's care remains in child care during these breaks for lots of reasons.
Senator Hoffman.
Thank you, Mr. Chair, and thank you, Mr. Koppel, because I know when the example I gave about the money being left on the table, there were programs, I know Ramsey County had Child Caring Inc. that was really looking at kids with special health care needs. I mean, it was a huge loss, when you saw something like that, and when you have a child that perhaps might be medically fragile and is gone for a period of time or whatever. My concern is that there are some supports in place so that if there's a temporary change in that child's life, that there's some systemic support for that individual. And it sounds like the answer is yes. Is that correct?
Mr. Koppel.
Yes, Mr. Chair, and Senator Hoffman, yes.
All right.
The intent of this whole reauthorization, which I think is a really beneficial nationwide, is to really prioritize the fact that stability of child care and predictability of child care are two of the most important ingredients of it, so that parents and not only can their work predictable in terms of support, but the child in terms of their support. So two really great pieces of this federal legislation.
Okay.
So if activity permanently ends in the, like for instance, the eligibility is not redetermined, you're not eligible. If you have lost your job and you don't have another job, you have if the activity ends, you have 3 months of extended eligibility. If new activity doesn't meet requirements, you continue child care until the next redetermination. So if you are going to school but you're going part-time, not full-time, or meeting the hours, again, what the theme I keep running into with every one of these details is we want the child to remain in care for 12 months in that child care. And only at redetermination 12 months later, unless there's some major break, which is that 3-month, you get 3 additional months and then it ends. So it could be 9 months, or lower if activity permanently ends, whatever that activity is that has gotten you the child care to begin with, then you would only have 3 months. All the other situations pretty much go to redetermination. So after 12 months, redetermination, and you're no longer eligible. So again, I'm just giving you details of what we already have gone over. One other piece, there is a 21-day payment timeline. Currently, our time frame is 30 days. So this brings it period of time that providers from billing to receiving payment is no longer than 21 days. There are changes that occur at various dates. When I talk about this implementation of all these changes, you see them up there, September 25th, October 23rd, and December 18th of this year. Notices will get sent out to families and to providers, letting them know these changes are being made, and these are the timelines for various ones. I can tell you exactly which ones happen when, but they're all fairly close together, as you can tell. They'll happen over the next several months. 2 bulletins have already been released. on these changes. So there are a few, we spent a lot of time on this the last couple of years. There have been some changes made. One of the big ones is what I just went over, the 12-month eligibility. But the ones that we still have outstanding are maximum rates. Our maximum rates are determined at the 25th percentile. You've heard that number a lot. And not to rehash everything you've heard, but 20 years ago, our rates were at 75th percentile in Minnesota. In other words, when you did a survey of all the providers, 75% of providers received their charges. Today, it's roughly 25%. So there's been this drop. And precipitously, there's been a drop in providers as well. And I'm not tying it all to payment, but just speaking of payment, we haven't met that. We've lost ground. What the federal requirement is that we update our rates to the most recent survey. So we're paying the 25th percentile, but it's based on a 2011 survey. So we're really lagging behind even in what the rates are. We've done a 2016 survey. What the feds are saying is, and what the law demands is that we update our rates. We can keep them at the 25th percentile if we choose, but we update them to that more recent survey, so at least they reflect the more recent rates. And that was a sizable price tag to it, and it did not pass last year. It wasn't included, but that is one that will be out of compliance. All of this compliance is by about a year from now. Just talking about that. And then the homeless families expedited applications, unfortunate. This is a priority of the legislation, is to accommodate homeless families, to expedite the application, and then over the next 90 days go back and get the information you need, that would give you a more complete application, more complete picture, but to get the children in right away into childcare. That would be another piece that did not pass last year, but would be really important and is part of the federal compliance.
Thank you.
I believe, does that conclude my remarks? If there's any questions, we'll take them now, or we can move to the health and safety.
Senator Kiffmeyer.
Here, Mr. Koppel. This is a little bit on the licensing and the prevention suggestions that we talked about before. And Ms. Ham mentioned that when they license, they focus on the physical facility. Absolutely appropriate, no doubt about it. And one of my thoughts was if the licensing could include payment systems. In other words, they're going to have to make payments as well. And so could you just give me a little bit of your thoughts initially on licensing, including something like, do they have a payment system in place? Do they have an auditing in place? Do they have something in place as part of the condition of initiating their service?
Mr. Chair, Senator Kiffmeyer, I'd love to answer your question. I have lots of views on it, but I don't have any technical expertise on it. Again, Ms. Ham is really the person who would, if we are going to change those requirements and perhaps Ms. Wagner can speak to it too, but if we're going to change the requirements up front to say, are you physically able to run your business with the infrastructure that you need? Could possibly be part of licensing. I don't know. We've had a lot of discussions about that point. That point in time when someone wants to open a business and what kinds of things to make sure that they have and know about and have a relationship there to get that over that first several months to make sure it really gets started right. I think that's a lot of what we've talked about in the Minnesota Minority Business Association, is really how to get the right things in place how to put a business plan together to assure success. Because for children, that's all I'm concerned about, is that we have this available for children and that they get the best. But I don't know what hardships that would put on someone to have a billing system. I don't, and I'll turn to Ms. Wagner to add any comment.
Sure. Mr. Chair, Senator Kiffmeyer, Reggie Wagner, I oversee the licensing division, and I think some of what your comments go to broadly are the department is charged with assessing the competency, evaluating the competency of a provider to deliver the service. And generally, we look at the physical plant, we look at the staff qualifications that are put in statute or rule to ensure that when we issue the license, we know that they have the right amount of, say for a child care center in particular, for square footage, space, that they have the right level of qualifications, whether it's teacher, they might need a mental health professional and other services. As we have seen more license holders, and this is across all settings, it wouldn't just be child care centers, trying to come in and engage in a new service, we have been very challenged in asking ourselves more questions about how do we evaluate sort of that business competency. And it isn't anything that is currently addressed in the rule. There isn't or statute. There isn't a requirement that they undertake a particular type of training. But we have looked at whether we would develop that sort of component and offer it either on a volunteer basis or actually come to the legislature saying, in the personal care assistant program, there's at least some framework for certain owners and billing individuals to go through a formal program called Steps for Success. And some of that does address how you bill. And so we've looked at that as potentially kind of a framework for, whether on a volunteer or whether we were to make that a condition of getting the license and to have certain key people go through a more formal structure. These are settings where providers can interface with some centers or family providers may interface only with private families. They're not receiving any sort of assistance, and that doesn't mean they don't have their own billing issues, that they don't understand that they need to, be looking at what are their taxes, what are their liabilities if they hire people. So that whole sense of business competency is something that both with some new immigrant communities and with the Minnesota Minority Child Care Association, we have also, from the licensing side, engaged in those conversations. So I think that you're touching on things that we have begun to put a little bit more thought into, and know that we do give a lot of technical assistance to applicants. And then the question is, how could we formalize that, and how could we ensure that when they get into particularly a licensed service that they need to be billing for public funds, that we are ensuring that they understand whether they have computer systems or software, that level. We haven't gotten to that, but I appreciate those comments.
Senator Kiffmeyer.
Thank you, Mr. Chair, and I appreciate them too. And boy, I do not want to go into another huge regulatory kind of situation. I think it's more a matter of, and it's not unusual to do this, to provide an opportunity to voluntarily take training and for you to provide it.
Yep.
Other times it's as simple as a frequently asked question.
Yep.
An FAQ can often start in a very low-level way, those kinds of things, and that's where there's no way. I think this particular area is already highly regulated.
Yep.
But I sometimes think beyond what is really in the best interest of the child sometimes. But I do think that some voluntary opportunities or FAQs is a reasonable approach for the department to take.
Yep. Thank you.
Senator Hoffman.
Chair, and I'm going to hold my deep questions until later, but the excellent question that Senator Kiffmeyer brought opened up a discussion, and I'm going to look forward to seeing what Reggie has to say, because there's some inconsistencies in the licensing and how we apply it, whether DHS is doing it or whether the county's doing it. So I'll hold
That's
up
a good point. I do concur. That was an excellent question. So Ms. Wagner, Senator Ralph, is this an excellent question?
No, it's an excellent comment.
All right. Thank you.
Just an observation here, and it's a discussion that I think we are going to have to pursue down the road, but it sort of is alluded to in Senator Kiffmeyer's comments. Personally, I have some very disquieting experience with child care and finding child care providers, and the fact that we do have a shortage and it's growing. And part of it is in this regulatory area, part of it is in the compensation area. And I just want to make a comment that I'm encouraged that we're looking at this, but it is reaching a crisis proportion. I have a stepdaughter who has 2 children she can't find daycare for, and this is not a good situation. So I just wanted to make sure we've got this.
Thank you. Okay, let's proceed. So, Ms. Wagner, thank you. Thank you, Mr. Koppel.
Thank you, Mr. Chair. Basically, when we talk about the federal compliance and what passed this past session, it falls into 4 broad categories: annual licensing inspections, consumer education, health and safety, and enhanced background studies. And so we'll just touch briefly on each of those 4 areas in the next set of slides. When we talk about child care, we have, through some of this reauthorization, really begun to talk about 4 distinct groups of child care providers: our licensed child care centers, our licensed family child care providers, and those, as Senator Hoffman alluded to, are the core of the licensing work under delegation from the legislature is done by counties, but the state oversees that work. Then we have exemptions from licensure. So Minnesota does have, I think, approximately 27 exemptions of services that can be provided that don't require a license. Approximately 13 of those involve the care of a child in some way. So there are exemptions for when someone else is looking for a child, and we continue to maintain some exemptions, but these last 2 groups are if a provider, and we call them either a license exempt center, those would tend to be school-based programs, generally a before or after school program, or a legal non-licensed provider. That would tend to be almost like an in-home, sort of looking like a family provider, but if they're only caring for up to 1 unrelated family, they're not required to have a license. So we didn't change any exemptions from licensure that exist. But if 2 of those categories are participating in registered to be eligible for CCAP payments because the family that they're serving is participating in the subsidy program, then they would have to meet some of these enhanced requirements. So we sort of are looking at, as we're saying, maybe 4 groups. There's a lot of similarity, but then there's going to be distinctions based on, particularly if they continue to fall in that licensed exempt. So one of the big changes from the reauthorization is that states are now required to do annual inspections of any licensed, certified, or regulated provider. Although the block grant talked about CCDF, that's our CCAP, that's the federal language, CCDF, eligible providers, we did not make distinctions around if a licensed center or licensed family provider participates in the CCAP program or not. We wanted one kind of seamless, robust system so that as a family might move, their situation might change, they might get a job in another place that might require them to look at a different child care option. We didn't want there to be this kind of patchwork of policies. So as we go through some of this, there are some places where the block grant did say if you participate in CCAP, but we chose to make this a very integrated approach to our license holders. So for the annual inspections, that is very different. The counties generally do the licensing and renewals on a 2-year cycle. And for the state, we had strived, although we haven't always hit 100%, to do re-inspections of centers on a 2-year cycle, and then for both the counties and the state licensors responding to complaints, responding to maltreatment, that appears to have happened, those would always be prioritized and would have an assessment and often an on-site inspection done. So even if we weren't seeing the program for a full monitoring, we were certainly triaging and responding if complaints and maltreatment allegations came up. The other bullets are just talking about what providers would need to have. By and large, for many of the changes for licensed providers, we did not have very much new ground to make up. Many of our regulations were already covering it, but these were sort of standards that they wanted all states to do. We were one of less than 10 states that were not doing annual inspections, so this requirement certainly was a bigger change for us and for the counties. Again, kind of having a broad category of 10 health and safety topics that each state would have to have, and some additional training that staff would need to have either before they would be licensed or certified, and then on an ongoing basis. The next slide shows you those 10 categories. The ones that have an asterisk are the places where we had to make some often smaller changes to come into compliance. So I think from the provider standpoint, what's helpful is there was not this whole new set of regulations that came in. The changes that we had to make by and large were more minor. Emergency preparedness is one that we did have to kind of move what the current regulations were a little bit further. And
Oh, Senator Hoffman.
Thank you, Mr. Chair. So, Reggie, as we're looking at, and this is where there's some inconsistencies in you look at health and safety topics, the building and physical premises safety highlight there. And for example, in the community I serve, there's tons of in-home child care providers, and yet one specific one just moved to a brand new house and was bringing her license with her, right? So the inspector came out and said, in this brand new house, you have to finish your basement, right? So you have to, because it became a building and physical premise safety, especially the fire code side of it, meaning sheetrock, cover the insulation that goes in the head. Yet, I've been to other places within the community, and anecdotally, those places that I've been, exposed concrete on the floor, exposed concrete on the wall, exposed rafters that have, the insulation hanging. You can see the wires that are there. So on one hand, the safety inspector is telling this person who had a license and was moving to change it. Yet on the other hand, here's these other providers I know that are complete violation. If there's a fire, it's not going to meet that 10-second code or 5-second code or whatever it is. It's going to be flashpoint because that's where the kids are. That scares me, and that scares me that there's inconsistency. The other thing that there's some inconsistency on that is on the licensed child care providers, the center-based, right, seem to have a more strict code of conduct, I guess is the word I can use, and wordsmith me, Jim, that's okay. Good. But I'm looking at, if they have a toy that has a little piece that's broken off, or anything that would be, they would be in complete violation, yet the in-home one doesn't have that same kind of standard, so to speak. And I'm just trying to see, is there crosswalk conversation? What are you doing to assure that there's, especially on the physical premise safety side, I think we would have a little bit more of a consistent approach on that. And you would agree with that, wouldn't you?
Ms. Wagner.
Mr. Chair, Senator Hoffman, excellent question. No. Senator Hoffman, the issue that you bring up related to inconsistency is a really important one. It is obviously a challenge for us. It's a challenge for us, particularly as we begin to bring on new staff, but certainly within our county-based delegated system. There are approximately about 110 licensors throughout the state at the county level, overseeing family child care. Sometimes they oversee more than one because the counties are also doing child foster care and some of the adult foster care. And so we have been hearing very clearly, and for several years, I will acknowledge, for several years, but we have not until this session had some of the staffing capacity to engage in that way with our counties on more training, more consistent training, We are looking to build a more county partnership, but county monitoring. We're going to be interacting with them differently as we go forward. There were several bills last session that had some training components in them. Those bills did not go forward, but we're looking at them. I think actually Senator Kiffmeyer had a bill with some provisions in there. And so there were some very good ideas. Of course, at the time, we said, too, we would need some resources. We believe we have some resources now from the federal compliance bill that passed with our fiscal note required budget request in there, that we're going to be looking at. How do we build in those ideas that, you know, legislators and providers had around training? So we're very much moving towards a more robust training system with our county licensors and more oversight capacity to do that, and to be engaged and to have a more responsive system if a provider says, well, we've been talking, this is not being consistent. So I don't know that there's going to be an easy answer for that, but I think that we are moving into a new framework with our counties and hopefully to be engaging providers that we can get to a level at which there is more training, more consistency, and more ability to respond when people identify things.
Yeah, Senator Hoffman,
Just
very
a
short, excellent question.
very short, and it'll be. So, do you need for the anecdotal examples that I know within the community where the brand new provider moving was told she had to spend thousands to sheetrock and cover, yet there's providers that still have wide open spaces. Is there language? Do you need new statutory language to assure there's consistency in that physical safety concern that we all have for youth within a home, or is that something that you can start to really enforce now?
Ms. Wagner.
Mr. Chair, Senator Hoffman, I think what I would have to do is to take this back and be talking with my manager in that area. And if it's a family provider, that would be really looking at what are the requirements in Rule 2, how are those being applied at the time of certainly the initial licensure. You know, I think it can be a challenge when a licensor changes and suddenly somebody, you know, yours happened potentially at the time that they were moving to a new location. And so they do have to meet the fire standards. There are things in the rule. But if other providers are saying, well, we know our basement looks pretty much the same and nobody's done that, I am in agreement. That would be troubling. We would want to know that, and then we would want to figure out how, particularly if they'd been licensed and had that condition there for a while, how do we address the health and safety, and how do we acknowledge that maybe that communication with the licensor wasn't as helpful, wasn't as clear. So I can't say for sure if we would need language, but I think we'll make a note and follow up with you on that.
I think one of our witnesses might have some thoughts about that, too, as we go and get into the discussion. So, Senator Kiffmeyer.
I know we're running into, I had scheduled some things because
Yeah.
we're going to take that break between 12 and 1. So can we come back?
I didn't
they're-
announce. I'm sorry. We weren't planning to break today. I apologize. We were just going to blow
Oh,
through.
it came out as that way.
Oh, I apologize. So, sorry. We were looking at the amount of work we thought we could get done in the 12:30, 1 o'clock range. We're actually going to go past that, clearly, from our discussions.
You're anticipating 1 o'clock? Because I can have things rescheduled.
I think 1 o'clock's a good guess.
All right.
I apologize. It's my responsibility. Okay, Ms. Wagner. So,
And Mr. Chair,
moving
members,
on.
I'll try to move quickly through it since you do have the slides, but to help address with the statewide, we had to do both a statewide emergency plan, engaged a number of stakeholders in that, also develop a template for providers to use that would meet the new federal requirements so that they could have a very clear path to being in compliance. Some of the new training that providers do have to meet, working with folks in Assistant Commissioner Koppel's area, working with Child Care Aware, there are some free trainings that are available to ensure that cost is not an issue to coming into compliance, and those would be available through at least June of 2018. I don't want to spend a lot of time on the individual training requirements. Wanted to just talk about license-exempt centers. Again, those tend to be school-based groups, either run by a school district or perhaps by a nonprofit or a Y, something in a school setting. We did work very closely with stakeholders to say, as you're serving CCAP families and these new requirements are coming, what is the best way to help get you to compliance? And they were very clear that they did not see the typical child care center Rule 3 regulation fitting them. And so we worked closely with a small group of representatives, particularly from some school districts and some of the nonprofits, boys and girls clubs, to really look at what kind of a regulatory scheme would meet minimum federal compliance and not go as much beyond that as we could avoid. And so I think we came up with what we call certification, only if license-exempt center is participating in CCAP. So we think that's a very narrow group. Our numbers are about 600 or 700. I think that they appreciated how much we tried to just work with them at a bare minimum and say good is good enough. We have been trying to do some additional outreach. We had a bill last session in 2016 that didn't get acted on. Then we've had it this session in 2017. It doesn't mean it's been the most, kind of transparent process. We know we didn't get a lot of committee time this past session to really get into the ins and outs of it, but we've been trying to do our some webinars. We have resources on our website. One of the changes is related to consumer education. It is requiring the state to have a single user-friendly, accessible website where a range of information is available for both families and providers. The website that the state has is parentaware.org. We have some links to licensing information from there. We also have our own licensing pages that we are continuing to add more information to. We do have a requirement in the federal block grant to post the results of the monitoring and inspection visits. This slide sort of shows our current licensing information lookup system. We are making changes to that. We've been having meetings with some stakeholders about what that might look like, trying to show them what some other states have done, talking about it potentially as two phases as we sort of live into some of our own IT work and building out a new website. There were some good discussions this past session on some bills that helped to really inform our work and kind of give us a launching off place with stakeholders. And so, we're hopeful that as we go forward and meet the federal compliance, that we're engaging stakeholders and building something that we think is more responsive to some of the concerns that we have had raised. This, for licensing specific, the very last, although it doesn't show up as an underlined hyperlink, but our website there, licensing/child.-care. Those are resources that we have out there, things that take information in both our Rule 2 and Rule 3 programs, try to put it in some friendly, as you were alluding to, Senator Kiffmeyer, some friendly FAQs, some good resources, and I think that we're moving in that direction, and I appreciate your comments about even the front end with our applicants on how we can do more of that. High-level background studies was another key component related to the block grant. There is a requirement for all, and this is for all. This is not related to just if you participate in CCAP. This is for all providers delivering child care services to have what we're calling an enhanced background study. Clearly, we have a background study system in place. It's governed under our 245C, Human Services Background Study Act, but this now requires a federal national background check, including an FBI. Currently, we only would do that under limited circumstances for child care if we had reasonable cause to think that they might have an out-of-state record. So by and large, current providers, family and center, are having a state-based BCA background check. We did move to a fingerprint background check back in 2015, I believe, but this would require us to interface those with the FBI and some other national registries. There is a new cost for that. It is $40 plus a separate fingerprint fee. We know that that will be challenging. We don't have a lot of control over that. We have tried to only pass on whatever the new cost of doing the FBI study is. We have not tried to go beyond that. But we certainly have heard from providers. You will probably continue to hear that this is a pain point, if you will, and we don't want to move away from that, but we don't have a lot of options at this point about that. This slide, I won't spend a lot of time in the interest of time, tells you the new components of that study. Quite honestly, it looks very much like an Adam Walsh study, if you're familiar with more enhanced FBI studies for out-of-home placements or adoptions. There are a few places that it sort of goes beyond that, but it's very similar to that, and so we are doing those now, and all states have been required to do those since about 2007, I believe. So, so it will be a change for the providers, but for the state system, it's similar to what we've been doing.
Well, and thanks. I just have a question about the 5-year part. The previous OIG was all excited. This is a one-shot thing, and so the people working in different DHS facilities do this one time, and then because of the FBI thing, then it's going to, you know, light up if somebody robs a bank or something. Is this the same thing, and why do you have to have 5 years and not just do it once and be done and wait for it to come back and let you know?
Thank you, Mr. Chair and members. Yes, this is so this 5-year provision is specific to the child care block grant. It requires that a study be done at least once every 5 years. If the state has in place, working with the feds, what they call various names, but sort of like that wrap back, where there's a continuous loop back, then you could meet that requirement and it could truly be a one and done. So this, I guess, sort of throws a wrinkle in our thoughts that it could truly be a one and done. And while 5 years is certainly a helpful extended time frame, we are trying to understand where the federal systems would be that would allow that to truly be that one and done.
But we're not doing wrap back now?
Well, we have, Mr. Chair, members of the committee,
DHS,
we have that with our state court information system. So the complexities of this is now interfacing with the FBI and their national databases and that continuous loop back, which doesn't quite exist at this time.
And none of your 600 or 700 IT people with Mr. Klein would have a, sorry, just kidding. It was an interesting day yesterday about that. So, but it seems if we can do it somewhere, we should do it here and just not burden providers with one more thing, especially the licensed homes. They don't have any free time anyway, and to go to wherever they have to go. And so just my feedback to you. And the centers, too. I mean, they're challenged just as well. It's time away, and 40 times whatever their number is turns into money. Thanks. Senator Kiffmeyer.
Thank you, Mr. Chair. And so, Ms. Wagner, a question I have for you on the background study requirements. One of them that I'm seeing just here is an individual at least 13 years or older who resides in a licensed family child care home or a legal non-licensed child care program. So this is in a home. Obviously, they live there. This is their home. But 13 years old going through a background check? Just because they live there? I mean, it's their home.
Ms. Wagner.
Could you just respond to, is it, first of all, is this a federal or state requirement? And then just some of the justification as to why you would even do that.
Ms. Wagner.
Sure. Senator Abeler, Senator Kiffmeyer, the federal requirement is for 18 years. The 13 years that is here is currently in state law. So we went into this federal conformity trying to meet federal conformity, but also to not change what current background study requirements are. So the 13 years is currently there. The change would be, obviously, with the new federal requirement, is that it would be an FBI study. But the current requirements are for household members 13 and above.
But that is state law, not federal requirement, as a condition of getting funding.
Mr. Chair, Senator Kiffmeyer, that is state law as part of our Human Services Background Studies requirement. So that has been state law for some period of time. Yeah, for all licensed family providers.
Okay, thank you.
Senator Kiffmeyer, yeah.
I'll just put it on the record. There's a cost to all of that, and you have family members going through all of this, and also puts them into a criminal system. And so seems to me that this is something to maybe take a look at. That's why I was trying to get at what's the justification. How many times do you find you're doing this and a 13-year-old is a criminal or a danger to the children for the cost that's involved?
Ms. Wagner.
Mr. Chair and Senator Kiffmeyer, I have somebody from our Background Studies Division who could perhaps make certain that everything I'm saying is in fact accurate and can hopefully amplify some of that.
Mr. Chair, Committee, Patrick Carter from the DHS Background Studies Division. Senator Kiffmeyer, I just want to clarify something that Ms. Wagner mentioned earlier, that the background studies for 13 to 17-year-olds do not include an FBI check, so they'd be state-based only, but they would include fingerprint-based studies. So there is a slight distinction there between the study for a 13 to 17-year-old as it's written in law right now, and any household member 18 years of age and older. But as Ms. Wagner said, the 13 to 17-year-old requirement has been in state law and continues to be in state law. The federal requirement is any household member 18 years of age and older.
And Mr. Harder, so the fingerprint part is new. Is that does carry into this? That's a new feature of this. And when you do fingerprints, is that automatically put into the FBI, or is that held only as a state item?
Mr. Chair, the fingerprints for 13 to 17-year-olds are a new requirement. They're in addition to what was previously in place. And in fact, all studies for licensed family child care programs and legal non-licensed programs have previously been name and date of birth based, and under what's currently in law, they'll be fingerprint based. So it's a new requirement for everyone in those home-based programs. In terms of the retention of the fingerprints for any state-based study, the fingerprints are not retained by DHS or the Bureau of Criminal Apprehension. Once the study is processed, those fingerprints are destroyed. We can't keep them legally, and we don't have a system to keep them, and state law requires that we destroy those. However, for fingerprints that are sent to the FBI has told us that they may retain those. They may retain them. If they do retain them, they've told us that they would retain them for the purpose of comparison with latent fingerprints, so fingerprints left at crime scenes that have not been solved.
Yeah, I got that. Once they get them, they don't give them up, I think. And so I'm happy that we destroy them.
And Mr. Chair, Senator Kiffmeyer, I mean, obviously, what I want to be certain that we're clear on is the intent of the fingerprints, even if it, I hear your concern about going into that 13 to 17 age, but there are unfortunately instances where there is sexual misconduct that happens even at that age. And so trying to get to that 13 to 17, this is a home-like setting. Yes, they're running a business, but it is in their home. They have other family members that are there. And we do have, unfortunately, times when there is some, criminal perpetrating by a teenage family member in that household. We have it for even younger people, unfortunately. It's not common. It's not common at all. I don't mean to imply that, but it does happen. And so we have to have some balance for people who are in a home-like setting where it can be more relaxed and people are coming and going and acknowledging that. But we have to find that balance of health and safety. And I believe that is what the statute has tried to do, for several years now at the state level at that 13 to 17 age.
Very enlightening discussion. So thank you, Mr. Hart. So plow through, Ms. Wagner, and it looks like you're almost done.
We can spend some additional time if people want. There is a few other places that the federal law tries to get into the disqualifications, and so again, we've tried to just stay very focused at what changes we would need to make in our Background Study Act to meet the federal requirement, and one of them does have to do with a new permanent disqualification that would apply only within the child care provider. So it wouldn't necessarily impact somebody if they were moving into a different place, that they would still need a background study.
And what crimes are those, Ms. Wagner?
I'm going to have Mr. Carter answer. Thank you.
I'm always interested in permanent bars.
Mr. Chair, committee, so the federal child care development block grant specifically delineated new permanent disqualifications for child care programs, and the legislation that passed in 2017 adopted those permanent disqualifications for child care only programs. some of the disqualifications were already, at the federal level, were already in state law as a disqualification, but they were not permanent bars. And so for select crimes, they were elevated to permanent bars. So I have a whole list here. I could read through them, but just for example.
Maybe just provide it. But yeah, so go through a couple.
Yeah, so just for example, a felony conviction for assault in the 3rd or 4th degree was not a permanent bar, but will be a permanent bar for child care programs. A felony conviction for arson in the 2nd or 3rd degree is not a permanent bar, but will be a permanent bar for child care programs. Let's see, any conviction such as assault in the 5th degree or domestic assault was not a permanent bar, but it will be a permanent bar for child care programs.
Interesting. I guess I'll leave it at that. So I have 16 questions I'm going to ask none of right now. So thank you. Anybody else on this? So Ms. Wagner.
Again, Mr. Chair, members of the committee, background studies along with licensing division has been doing some outreach sessions, been going to conferences and presenting, also going to provider groups across the state. So we are trying to really continue to inform everybody about what the changes are. There is no official, there has to be some systems work done, building on the IT conversations apparently. There are some systems work that needs to be done, and so the statute allows the commissioner to sort of develop that implementation plan for when these new changes and studies would be required. So we intend to be very communicating with providers well in advance, looking at capacity for where they would get fingerprints done, trying to be very thoughtful as we go to roll this out.
And there aren't a lot of places where you can get fingerprints, right?
Mr. Chair, again, Patrick Carter from DHS. So there's a current statewide infrastructure right now for fingerprint collection for the fingerprint-based studies that DHS does right now. So we do fingerprint-based.
But how many places are there across the state?
There's about 70, 75 locations across the state. But as a part of these child care changes, we estimate that there will be about 120,000 current child care providers that are going to need to have a background study. And so we are kind of rethinking how the fingerprint infrastructure is going to work across the state, understanding that we're going to need more capacity, and it's a priority for us to make sure that they are accessible, that a provider won't have to drive 70 miles round trip to get fingerprinted, that they can go to their county office and get fingerprinted, just for example.
Yeah, and there's law enforcement places around. So my hope is you all mean really well in the oversight you do. But as we discussed, some people don't need any oversight. They're like complying, they are model, and they have to endure all this stuff because some people misact. And so as you craft your policies, as you implement them, a lot of this stuff came in late as part of the final agreement. And so I'm just reminding you that we don't have enough people providing child care as it is now. And when you make it really hard for a person who's really a good person to do it, you're going to get less. And we're going to have even a more, it's a balance, and we want to protect, but you also have to allow the service. Senator Kiffmeyer, and then we're going to move along. So.
Thank you, Mr. Chair. And I really appreciate that final comment, because as I was sitting here, that's what I was thinking as well.
Yeah.
It a little bit flew recently, and this sense that every passenger is treated as a potential terrorist killer problem. And you go through the process because you need to fly, but it's really offensive to be looked at askance and being wondered about your bottle of water or your 5 ounces of hairspray instead of the legally allowed 4 ounces to get on a plane or whatever it is. But it's just the general tone of looking askance and dealing with that. And we all understand there's the 1%, but the 99% are paying for that and living under that kind of a cloud, on a routine basis. And so I appreciate your comments, and I know you deal with some of those things, but for regular folk, it just gets to be really old at living under that. And I think it should be kept in mind.
Well said, and I know you know that. And so that's the balance. So I think this is productive. I really appreciate the testimony. It's very good work there. We have 3 more witnesses, and why don't they all come down together? Ms. Sanford, Barty Walty, and Wahi, and Ms. Seidel, if you want to come down. That'll save us transit time, so. We'll just go in the order that you're listed, so Ms. Sanford would be great. Do you have enough chairs? Oh, there's just 3 of you, right? Okay. I kind of like panels anyway. That way you're not so lonely. It's like one big happy child care family. Sort of.
Well, and this
Welcome
is so
to the
lovely.
committee.
This is more like a big dinner conversation than rapid fire speeches trying to get through a hearing.
Yeah, thank you. Welcome to the committee.
Thank you. Thank you, Chair Abeler. My name is Claire Sanford, and I represent the Minnesota Child Care Association. We're a statewide association of about 250 licensed child care centers in Minnesota. And first off, I'd just like to express our gratitude, the gratitude of the Kids Can't Wait Coalition, of which we're a member, and many others, on the steps forward for CCAP last session. We were thrilled that most of the package of the family-friendly, what we called the family-friendly reforms that were federally required, were passed and are being implemented this fall and winter. And those are the things you heard about from, thank you, Assistant Commissioner Koppel, the 12-month authorization, the stable co-pays, the stable child care for activities. So children will stabilize, parents will stabilize. These are great steps forward, so we're really glad that Minnesota is coming into compliance with those federal regulations. I'd also like to point out something that hasn't been directly mentioned, but I'd also like to give our thanks to the legislature on, is the development of something called a fix-it ticket in child care licensing, which passed last session. And we've kind of danced around. I know Senator Hoffman has brought some of this up, sort of the relationship between licensors and programs and consistency among settings. And the fix-it tickets are something that we hope will really continue the move that DHS, the path that DHS has been on, to move to more of a partnership role with child care providers, and one that feels less punitive. So the fix-it tickets will allow child care providers, instead of getting a full violation that needs to be posted on the wall and all this stuff, if it's a minor thing that doesn't impact health and safety, they'll get a fix-it ticket, they'll be able to fix it within 48 hours and move on. So we're very thankful for that and look forward to continuing to work with DHS on what qualifies for a fix-it ticket. Also, just thankful the legislature is still paying attention to child care. The last 2 years, the legislature spent a lot of time and energy on this issue. The Office of the Legislative Auditor is working on this issue as we speak. And a whole lot of attention is being paid to the critical role that child care plays in our state's economy. You can't find a business without a help wanted sign across the state of Minnesota. And you can find plenty of businesses feeling the strain of not having child care for their workers. I think it speaks volumes that the Minnesota Chamber of Commerce, for the first time last year, put child care assistance in its education and workforce platform. It was not something they'd previously advocated for, because they are hearing that statewide from their employer members saying, we can't hire, we can't expand, this is a real problem. It's also good to keep the focus on early childhood solutions that allow parents to work. There is just data that came out this week from the National Survey of Children's Health, which found that in Minnesota in 2016, over 30,000 parents altered their employment arrangements to their economic detriment because of child care access and affordability challenges. So that's 30,000 parents in the state of Minnesota who left the workforce, reduced their productivity, turned down promotions or raises because of how this system is not working for families. So we're glad that child care is being viewed through the economic lens as well as a two-generation support that supports the workforce of today and of tomorrow. And now we need to finish the job on the CCDBG compliance. As Assistant Commissioner Koppel already stated, the child care assistance reimbursement rates are huge and are still a requirement that we do something with. They're a big ticket item, but they're incredibly important, and we need to finish the job of coming into compliance with those, in addition to the homeless expedited provisions, mobility among counties, just making the program work for the realities of our workforce is incredibly important. And increasing those provider rates, I wish Senator Laurie were still here, because I misspoke myself once last session and he got very upset because I had attributed something to a time that he was chairing something. And I said, no, I'm sorry, I said the wrong year, I didn't mean it. So I wanted to promise him I would never misstate that year again. But as you've heard, child care reimbursement rates did used to be at the 75th percentile, which is what the federal law does not mandate, but says really is the standard to ensure access for families of low incomes. And in 2003, those rates were slashed in Minnesota, and it's shameful that we keep talking about how we need to increase quality and increase education and training for providers, which are good things, but we still are not able, in many cases, to pay them a wage that allows them to live without relying on public assistance programs. And CCAP rates are a big part of that. I wish Senator Ralph was still here too, because I had an experience in Sartell recently in his area where I was in a child care center and there was a staff member who was in tears saying, I have my bachelor's degree, and my parents say, why do you work in childcare? Why don't you go work somewhere else? You could make so much more. And I keep telling my parents, this is what I want to do. This is where I feel at home. But literally, they opened a brand new Quick Trip across the street, and they're advertising starting wages more than I'm making now. And you don't have to have a BA for that. You don't have to have the same responsibilities I do. So it's a real burden on providers, both to stay in the field and to enter the field. Providers can't charge more because parents can't afford more, and staff cannot make less. So these reimbursement rates matter. They matter to parents who need choices. They matter to a very diverse and overwhelmingly female workforce, much more diverse than the K-12 system. And they matter to kids who deserve to be in the programs that meet their families' needs for cultural responsiveness, quality, location, schedule, and all of those things. I won't say much about fraud prevention because we all already decided no one likes fraud. We like preventing it. Continue on. I also wanted to mention the positive supports rule as sort of unfinished business from last session. And this rule has now been in effect for over 2 years, went into effect in August of 2015. And for the last 2 sessions, the Child Care Association has presented a bill to exempt licensed child care providers, both family and center-based, from the training requirements of it. And not because we're evil people and we want to do bad things to children with disabilities, it's because we feared negative consequences. The training requirements are so burdensome for what is probably a very tiny segment of the population we serve, and the training doesn't match what we do in early childhood. It's more focused on adults. So we have been worried that having to meet those requirements would cause a decrease in access to child care services for children who already face certain disabilities and are covered by this rule. And we've been working with DHS to find ways to make the rule make sense for child care. We have yet to be successful. It's not for lack of trying on both sides, the provider side and DHS. We have been working a lot on the administrative side to try and find, are there flexibilities? Are there things we can do to make this make sense? But we're already seeing negative consequences. Our association had a board meeting on Tuesday morning of this week, and there were several providers who already said, if a parent comes to me and we ask the question and they say, their child is covered by the rule, we say, no, I'm sorry, we can't serve you. And we are shutting those families out because we can't have the liability of all of this training that doesn't relate to what we do. Providers are upset, parents are upset. The rule is intended to protect children with disabilities, but an unintended consequence is that it's causing them and their families to face these additional challenges and lack of access. And last year we had a bipartisan amendment in this body with Senators Abeler and Senator Hoffman, which would have exempted child care providers from the requirements, but also add in some additional language that made it clear that child care providers could not do certain things with children covered by the rule. So we wanted to remove the burden from child care providers, but also make very clear to parents and the public that we would not do certain things that this rule was trying to prevent. Unfortunately, that didn't pass in the end. So we got to finish the job on rates. We got to work on the positive supports rule. Thanks for Fix-It tickets. Thanks for family-friendly reforms for CCAP. It's good to be back to work.
Thanks, Ms. Sanford. And that rule, it still chafes at me. I don't know where I have a lot of appreciation for DHS, and I want kids to be safe, and I want people with special needs to be looked after and treated, well, we all do. But some things are just madness. I thought we had a good solution, and they dug in, and we'll revisit it, but I hope we don't lose more child care providers over that. And that's the point we've made in the last 2 days, is that make it sensible. Just make some, like, oh, that's reasonable. And, okay, so anyway, Senator Hoffman, you'd echo it, but we got to keep moving, so. You can say ditto if you want.
I'm going to say ditto on just one question. Can I just, and it's real, I just want to know the numbers.
It's a free
Can I just
country. You
ask
get to
Claire?
say whatever question, good or bad, you get to
Back in
ask.
1974.
As long as it's excellent, Senator Hoffman.
Sorry.
Commitment to keep working on it, because I know the intent of why the Jensen settlement agreement occurred and the cross-sectionality that occurred because of the U.S. federal judge, and he's the best U.S. federal judge we have in the United States, period. I'll just say that. But my question to you is just how many youth, when you look at the child care space, how many youth are we talking about here? The potential, how many youth are we talking about affected by that, Claire? And then we'll go with that and we'll keep working on what we need to work on.
Yeah, Ms. Sanford.
Mr. Chair, Senator Hoffman, we don't know exactly, but we've been told the universe is probably very small, and we've done some of our internal surveys, and we're actually in the process of doing that right now at one of our large member providers. But we deliberately surveyed parents of children with special needs at certain providers that the school districts actually refer children with higher needs to, because they're known as providers that are able to work with these children and families very well. And we thought when we did that, we might find, okay, a handful of these children are covered by the positive supports rule. And so far, I mean, we've only done this with a few centers, not statewide or association-wide, but when parents were actually asked with the specific language in statute about that qualifies someone for the positive supports rule, none of the children so far that we've asked who do have significant special needs
But they can't go now.
have qualified for the positive supports rule. So that makes us think even more so that this is a really big, there's a very small universe, especially in the birth to 5 space, because often these issues are identified later in life. But it's a very big response to a very tiny problem. It feels like taking IV antibiotics for a zit. Like, I say all sorts of stuff, Barty, I know. I talked about lasagna last session, but
Thank you. I appreciate that. So it's kind of like hashtag fail. So thank you. Ms. Wahi, welcome to the committee.
you can stop laughing.
Sorry. Good afternoon, Chair Abeler, members of the committee. My name is Barty Wahi, and I'm the Executive Director of the Children's Defense Fund of Minnesota. I want to thank you for the opportunity to testify today and to connect with you before the pre-session hustle starts. So thank you. Children's Defense Fund of Minnesota has been a long-time proponent of affordable, accessible, nurturing, and relevant, high-quality child care. That's because we believe it's a 2-generation approach that helps parents get to work and also helps our babies and kiddos develop in fun and safe environments. Claire referenced, I think today, the information that was released about from the National Survey on Children's Health that 30,000 Minnesotans have to make really difficult choices about jobs and about work based on the availability of child care, both its affordability and its accessibility around the state of Minnesota. And it's a critical workforce issue, and it's a critical child development issue. And we think that, and we're grateful that you are today talking about this and how important it is. Thankfully, the Child Care Assistance Program, or CCAP, is available to reduce the cost to help child care for thousands of hardworking, low-income families across the state. It is an opportunity that helps families afford child care, and it also helps to support the system of child care overall, in which many of us participate. On behalf of the Children's Defense Fund and as a member of the Voices and Choices Coalition, as well as the Kids Can't Wait Coalition, we want to thank you for passing the family-friendly provisions last session that align the program with federal requirements and national best practices. Also know that as we move into the 2018 legislative session, there's more work to be done. Many folks have referenced that, but I also want to throw our support on two sort of unfinished elements of the federal family-friendly provisions that we'd like to see done. First of all, we want to make sure that those provisions that are related to helping and supporting homeless children are put in place so that they can they can have access to a high-quality learning opportunity early, because we know those kids need it more than most, and that also it helps really stabilize the family to move to greater economic stability. We also want to put in a plug for the increased reimbursement rate. I have crisscrossed the state of Minnesota this last 5 months, and I've talked to business leaders in Dawson, Minnesota, and I've talked to child care providers in Mountain Iron, and the challenge of the business model for child care providers is significant around the state. Part of that is because we are not able to fund the system appropriately, and it has ripples across our community. It impacts our business community, it impacts other child care providers, it impacts other families, even if you don't receive CCAP. The child care system is an ecosystem, and when you starve and you part of that ecosystem, it ripples out to all of us. So we would encourage you to really look at the 75th percentile as a critical way to think about reimbursement, but at a minimum to really look at the federal requirement that would tie the rate to the last biennium survey. Finally, I think I would be remiss to not take the opportunity to make a plug for more fully funding our CCAP program here in the state. Every day, between 4,000 and 5,000 families who are eligible for this program are unable to take advantage of it. Many more just never even apply because they know that they have very little chance of getting it. In a time when we see people leaving the field and we see people unable to work, and we see, I hear from business leaders who are telling their staff to bring a bassinet to work because they know that employee is struggling with childcare. I think that we can do better, and I think supporting this the CCAP program is one effort in being able to make a more robust system for our state. And in conclusion, I think it's going to take bold action and leadership for all of us, particularly you, and we stand at the ready to work with our colleagues here at the state capitol to make that happen. Thank you.
Thank you very much. And Ms. Seidel, just because you last doesn't mean you're the least important. In fact, I'm kind of eager to hear your thoughts, and I think this conversation is going to spill over to our November time too. So, but please tell me what's on your mind.
Well, thank you, Chairman Abeler and Senators, for being here. I am testifying on the behalf of the Minnesota Association of Child Care Professionals. A year ago, I came here and testified in front of the task force on several occasions and was charged with addressing the child care shortage in Minnesota. Myself and many other child care providers testified about enforcement inconsistencies and frequently changing interpretations of rule and statute by the Department of Human Services, redundant and unnecessary paperwork, overregulation, and lack of communication by DHS to family child care providers. It has been a year, and I wish I was here to tell you that things have improved. Unfortunately, these issues have continued to worsen. Since I testified last year, and based on the numbers DHS gave the task force, we have lost almost 1,000 family child care providers since then, on top of the thousands that we have lost over the last 7 years. We have lost 211 providers just since the session ended. Although DHS was required by legislation last year to communicate changes in a timely manner, family child care providers are still waiting for any communication on the significant changes that were made behind closed doors and without input from family child care providers last session. Last year, when many child care providers and myself took time off to testify before the legislative task force in regards to the struggles over the last 7 years, we were so optimistic that positive changes would be made so that providers who have opened their hearts and homes to Minnesota children could remain in business, and Minnesota families would have viable, quality options for child care. The bipartisan task force released dozens of common sense recommendations that could have had an enormous positive impact. Sadly, only a handful of these recommendations were even introduced, and out of those, very few were passed. Instead of reform that Minnesota needed to address the growing child care crisis, Minnesota family child care providers found themselves with more regulation, more unnecessary paperwork, more hoops to jump through, and more training requirements than they had last year when they were here telling you, our lawmakers, it was too much. What's worse is nearly all of these changes were made at the end of the session, behind closed doors, without an opportunity for public testimony or input. DHS spoke today about the implementation of these new rules. One critical piece of information that was left out of their presentation is that the people who are affected by these rules and regulations are still in the dark. Child care providers have received nothing by mail or email since February of 2017, and since most of these new laws were passed after that without any public hearing or discussion, providers still don't know what is expected of them. One of the regulations requires providers to have an emergency preparedness plan filled out on a form developed by the commissioner by September 30th of 2017. To this day, providers have not received notification, and as of yesterday, when I spoke to my licensor at Anoka County, they have not been informed by DHS either. Because no one has heard from DHS as to what is required and what form is to be used, just about every provider in Minnesota will be out of compliance with this new regulation come the 30th of the month. Another provision that was passed behind closed doors without stakeholder input or public hearing was the new enhanced background study. This includes fingerprints, photographs, and the creation of a permanent FBI file where data above and beyond the criminal history will be collected and permanently stored by the FBI. In the legislation, DHS was allowed to reclassify our children as child care staff persons. So this would subject them to the new background study. The CCDBG does not require this. The final rulemaking only expanded it to adults 18 years or older who live in our residence. Expanding this to our children is a violation of their privacy, and their basic rights or our criminal justice system is supposed to guarantee them that they will be innocent until proven guilty and their record will remain free of accusations. I'm sorry, this is really upsetting to me. Think about dragging your 14-year-old daughter down to a police station to be fingerprinted and mugshot because she lives in the home. And if anybody thinks by fingerprinting a child it's going to keep them from being an abuser, you're wrong. If these children were already abusing, it would be in the system and the provider would not have a daycare license. This is not going to keep a child from abusing. It's going to torment these good kids. Just as you had stated earlier, we're tormenting the 99% because of the 1%. And this is my child we're talking about. I apologize. Something as serious, unnecessary, and potentially life-altering as this could never be done behind closed doors and without public participation and feedback. We've already heard from hundreds of child care providers who will close their business if their children are subjected to this. There is no reason a standard criminal background check is not sufficient for our children. The cost of our background studies by legislation were to be no more than $30 per study. However, as you heard DHS state, they're charging $40 plus an undisclosed fingerprinting fee. Most of the CCDBG requirements were limited to child care providers who care for children on CCAP, which is approximately 1/3 of the licensed providers in Minnesota. However, DHS and this legislature unnecessarily expanded these regulations to thousands and thousands of providers who only care for private pay clients. DHS has also expanded on what the expectations of these new regulations are to their own discretion. When does this become unacceptable enough to the legislature? How many more families need to receive notice that their child care provider is closing? How many tax-paying, women-owned small businesses are going to be driven into the ground before this bipartisan common sense recommendations are going to be given consideration? At what point is there going to be accountability? My primary purpose for being here today is to share with you the troubling feedback that we've received from child care providers in our state. They do not feel that DHS or this legislature values them. They do not feel that their input is heard, even when they close their business for the day and drive all the way here to testify in front of you. They are frustrated, they are worried about their future, and they have lost almost all hope that anything will be done to help them. We will continue to lose family child care providers until this crisis is addressed, and with each provider that closes her doors, Minnesota families lose approximately 10 licensed licensed child care spots. That is more than 2,100 since the legislature adjourned, on top of the thousands that have been lost since 2011. You cannot build centers fast enough to offset this rapid loss, and even if you could, center care costs families approximately 2 times more than the home-based care. Many families cannot afford child care as it is. This has robbed parents of choices and has forced many to turn to unlicensed, unregulated care where the provider is not required to even have the most basic trainings as CPR, first aid, SUIDs, abusive head trauma, and safe sleep practices, which we know has saved lives. You are not making children safer. You are placing them at a greater risk when you take away their licensed, trained, inspected options for care. The legislature was not ready to address this crisis last session, but we are waiting and we need you. Minnesota families and children need you. We are fully prepared to roll up our sleeves and work together with you to reverse the decline of licensed family child care in Minnesota. I have here the list of bipartisan recommendations from the task force. So when you're ready, please let us know. Thank you for your time.
Thank you, Ms. Seidel. And I had promised we're going to quit at 1, but I just can't quit just yet in good conscience. And so, Senator Kiffmeyer, if you have to go, I respect that. But I just have to get some. Who in the audience from you guys can go. We're going to have a discussion about this now. I need some chairs. Who from DHS would be the person I need to talk to about some of this stuff? Ms. Seidel, please stay. So where's the head? I need the head. And come on, Reggie. Yeah. We're not going to solve this today. The meeting in November is going to include Chapter 2 of this. This is what I was worried about all along. I was not part of the discussion that brought this together. It happened. I didn't like the process. I don't like the product. I didn't know till this testimony even some of the challenges with the product. This is not okay. And so we talked about ears and feedback and dialogue, and I have no doubt about your good intent and your desire to protect. If we run the system out of business, the good news is there'll be no one getting harmed. If there's no more child care, home care, good news. Hey, everybody's safe. But we have kids with disabilities who can't get care because you all, whoever, I don't know where, and you're just here, you're the head, but this is not okay. And I don't know what to do in public right now, having prepared nothing, so I'm not going to do anything like that because it would be untoward and not get us where we're going to go. I know Ms. Seidel. I know the people she works with. I got a crowd of them in my district, in my county, and I admire them for what they do. I could never do what they do, and they love each of those children, and they wake up in the morning, they skip vacations, and they have chosen to engage themselves in those kids' lives. And they endure it in the interest of some kind of a job, but passion for the kids. That's what drives them. They could make better money in a lot of things, but this is what they do because they care about those kids. In our system, we have failed to protect the good people from how we're treating the bad people. And there's got to be a way to figure out who's likely to be bad. I'll give you a hint. It's not her. And it's nobody in her association. And we are failing. And so I'll let you respond. You don't have to say much, but it's on my radar, and we'll be having meetings in October in my office. But so for today, go ahead, Ms. Wagner. With that set up, I guess I don't envy you right now, but go ahead.
Yeah. Mr. Chair, members of the committee, obviously I'm, as the head of licensing, I'm doing a lot of listening. And I'm trying to get out and meeting with the providers. I'm trying to understand where we have to work with Ms. Seidel, with others who have been in this field 10, 15, 20 years and are trying to bring others in. Yes, we have providers leaving. We also have providers entering. And so we've got to figure out how to support those who are. We have this churn, but we do, for family providers, have a net loss. And so we've got to figure out who is still coming into this field. They are coming in. Where are they coming in across the state? How do we support them? How do we take what these providers are saying? How do we look potentially at, different models to support and incent folks to come into it? I have heard very, very clearly from this past session, as I've moved into this role in overseeing licensing, as I've tried to be more in dialogue with the providers, frustration, huge frustration, distrust. I will own that, because if we don't own that and we don't acknowledge that this department, licensing in particular, needs to figure out how to both embrace and have providers accept our role as regulator, but also as technical assistance and compliance. Many of you have raised that here today. You've raised it in different hearings this past session. They have sensitized me personally as part of my onboarding, if you will, in the last year or so about the implications for them as businesses, but also as people who are very committed to children and to other people's children, which quite honestly is one of the most sacred things that we can do, is to entrust our children to somebody else for a significant period of time. And I don't take that lightly as moving into this role. Our county delegated structure presents its challenges. It absolutely does. But I am trying to embrace those challenges. I'm trying to build a structure where we can be more responsive. Providers have made it clear that they want the state to be involved in getting some three-legged stool that works. I'm very committed to trying to do that. So I don't have any answers. Some of these are certainly beyond me, but I want you to know that I am hearing a lot of what is being said. I am trying to make myself available to hear even more, to build those relationships, and to say, what suggestions do they have? They are in this field. They are committed to it. How do we build upon that?
Senator Kiffmeyer.
Thank you, Mr. Chair, and I appreciate those words. However, having been the author and spent a huge amount of time last year, and at every single step, at every single bill, at every single time that we worked to come up with language, we were dead-ended every single time by DHS, every single time. We were fought against, made things more difficult. And so those words, while I appreciate them, ring very hollow right now. And much deservedly so, the folks that are here today. And this has consequences to real people. And so enough with the words, enough with the dialogue. There is bipartisan work. There is bipartisan support. And I think choosing those things that are most egregious and getting some of them done is absolutely crucial, and enough with the talk, because it's not right to do this to people. First of all, they are our people. They are Minnesotans. Mm-hmm. And so because you do in-home child care, doesn't mean somehow now you are persona non grata and have to somehow justify your existence and your integrity on a regular basis. And so whether it is this or a variety of those things, I think it is something that I look forward to. But I want to tell you, if it's not sincere in making that kind of progress, then there will be another way of making this a little bit more important. Just as a little bit of an example, and we just worked with all this ID, this got me on an airplane. It's my Costco card. This got me on an airplane. I had no ID, didn't have my credit card. It slipped down in the car seat as I got out, searched and searched, but I had to get back for Senate business. And so, interesting enough, I showed the lady at the desk. I said, I have all this stuff, I got in here, and she just didn't care. But she said, oh, there, this one. She said, we can use this one. And it got me on the airplane, got me through TSA, and even got me through parking. Kid you not. I'm exiting from Terminal 2 and parking, Terminal 1 rather, and I didn't have my credit card. I had another one. She said, well, just give me your ID. I don't have that either. And again, I said, do you think this will work? She said, yes, that'll work. Sometimes we make things just way too complicated. And a little humanity and common sense can be very good. And I know I stayed for this because, Mr. Chair, this was a very important part of my being here today. So I would perfectly happy to do some of that. It would have been a little more convenient, but it's okay because I wanted to be here for this. And it is very important, but I will not be in a situation where I go through another time where good people are stonewalled by their own government. That's just not acceptable.
Thank you. So to bring this in for a landing for now, Ms. Seidel, if you would, I've been waiting for this discussion, frankly, about the bill. I knew there were some concerns. I haven't heard a lot from people, and this was why we did the hearing today, was to have some feedback. Summer came and went. So if you and your colleagues could put together, if you need help with the list of what passed, we can help you with that. But if you can just enumerate your concerns with various elements, and we're going to judge that against the needs and the desires of the department for safety and organization and all of that. But in my mind, the positive supports was low-hanging fruit. If we can't figure out that one, good news, no kids with disabilities are going to be harmed in daycares because nobody goes. I'm not sure that's what we're after. That some mother, just imagine the mother who has this 4-year-old kid, and they go through hell every day and dedicated to the welfare of their child, and now they can't get a child care opportunity for that child because of this rule that was supposed to protect them, and now they're being truly harmed. And they don't sleep at night, they don't sleep in the day, and they can't keep their job. That's not what we're about. And so I intend to go through every concern that the licensed homes have, and if the centers have concerns as well, this is not limited to them, but if it is true this is a statewide economic development issue, that in Albert Lee and Worthington and wherever else, they can't keep workers because they can't find places to have their children be looked after in a quality way, then this is beyond just this committee. And we have to be sure that we do enough to make sure that those bad actors are kept out and even inadvertent things don't happen. But you don't need a hammer to hit a fly. So anyway, Senator Hoffman, you want to say anything? Or you get the last word.
Thank you. 45 minutes for the last word.
No. We've been waiting for 45
Well, it brings back to the importance of why we had our little Birth to 5 conversation last year, which started, with little small steps that go to it. And it is, Reggie, you have a huge job in front of you, especially as we increased the child care, we've increased access, parents where everybody, even though we've known the birth to 3 since 1986 has been, on people's mind. It's how do you find a system that's fair and just for everybody, and how do we make sure that it's family friendly, that conversation, and I'm glad we're having it. These are hard conversations to have, Mr. Chair, but you seem to be the one to want to be able to, let's address this and let's do it forward so that all the intentions are there and they're good. And again, going back to what we started with, the Birth to 5 conversation, this was part of it. Assistant Commissioner Koppel was at the table. Everybody was at the table coming. I liked the process. I think we could do this with this process as well. And it's well worth the investment for the state of Minnesota. And I think it addresses some of Senator Kiffmeyer's issues. It addresses where we need to go with the inconsistencies that are there between our providers that are licensed and getting CCAP. There's just so many different avenues in there. So these are good conversations to have, and they're hard ones, but you know what, we're going to have them, and let's do what's right for people of Minnesota.
So we're just about to wrap up. So a week or 10 days, if you can get me that list, then I want to just add the disclaimer on this. It's not about you, Ms. Widener. I have a lot of respect for you, a lot of respect for every worker in your department. But sometimes departments get together and they get this thing going, and you wind up with a product you didn't want. And if a committee designed a horse, it'd be a camel. And camels don't work. We need a horse. And so we've got a well-intended camel that's not working. And it's not working. And so under our bipartisan efforts here, we are going to see to make it better. And at the end, your department will thank us for helping with the product. Because when we focus on the mission and the product, that picture we had of happy kids, and if that would be kids that weren't otherwise happy, that's the product I'm after. And to keep ones who are just not at risk, just keeping them on the track and keeping places that are convenient to go, So the parents a little more time at home. They're not going to drive 45 minutes. They can drive 12 to their choice place that they've always liked. That extra hour and a half a day is the family time that they have to be with their kids. And so I'll stop. I'm going to say something I'll regret. So this has been very productive. I want to thank all the participants and people at home. If you have thoughts on this child care matter or other parts, our emails are open. Thank you very much. We're adjourned.